Now, talking about the muscles, we have the muscles of the anterior compartment. These muscles are called the extensors or the dorsiflexors of the leg. They are four muscles: the tibialis anterior, the extensor hallucis longus, and the extensor digitorum longus. One more muscle, the peroneus tertius, that can be found and cannot be in some individuals. Talking about the first, which is the tibialis anterior, it originates from the lateral surface of tibia and the interosseous membrane, and inserting in the medial cuneiform bone and the base of the first metatarsal bone. Here. This original insertion helps for the action, which is foot dorsiflexion and foot inversion. The muscle is supplied by the deep fibular nerve and by the anterior tibial artery branches, and also to a lesser extent the posterior tibial artery branches. One medical correlation which is really important for this muscle is that people with an inhibited or weak tibialis anterior, for example those with hemiplegia or Parkinson's, will have an abnormality in their anticipatory postural adjustment. During gait initiation of the affected limb, they will try to compensate for the weakness of tibialis anterior by overactivity of the contralateral tensor fascial head. Next is the extensor hallucis longus, which originates from the middle third of medial surface of fibula and interosseous membrane to insert in the base of distal phalanx of great toe. The action is to help in foot dorsiflexion, innervated by the nerve, deep fibular nerve, and the artery, anterior tibial artery. One important point that we need to focus on is that the absence, or if we said an absent motor response in the extensor hallucis longus muscle can occur due to muscle or nerve damage. Paralysis of extensor hallucis longus results in constant flexion of the big toe due to the unopposed action of the flexor muscle. Considering the fact that extensor hallucis longus and its tendon run mostly superficially in the leg and dorsum of the foot, the muscle can easily be injured by dropping sharp objects in this region. The weakness or paralysis of this muscle can also indicate L5 nerve root damage, which is common location for discus hernia. One more thing, it's important to mention the compartment syndrome, which is a relatively common cause of the dysfunction of the extensor hallucis longus muscle. The compartment syndrome is a medical emergency caused usually by blunt force trauma to the anterior aspect of the leg due to strong and inflexible fascial membrane. And in our workup, it's also related to burn. The swelling increases the pressure, which compromises the circulation and function of the muscles, the extensor hallucis longus. Within that space, the compartment syndrome requires an emergency surgical intervention. Then we have the extensor digitorum longus. This muscle originates from the proximal half of medial surface of fibula, lateral tibial condyle, and the interosseous membrane to insert in the distal and middle phalanges of digits 2, 3, 4, and 5. This muscle helps to dorsiflex the foot at the talocrural joint and foot eversion at the subtalar joint. Innervated by the deep fibular nerve, blood supply is the anterior tibial mainly, with other arteries like the fibular, the anterior lateral malleolar, the lateral tarsal, the metatarsal, the plantar, and the digital arteries. Finally, we have the peroneus tertius or the fibularis tertius muscle. This muscle originates from the medial surface, the distal third of the fibula, the interosseous membrane, and the anterior intermuscular septum to insert in the dorsal surface of base of metacarpal bone number 5. It helps in dorsiflexion and eversion, innervated by the deep fibular nerve and the anterior lateral malleolar artery. This muscle can be found in some individuals. I think 15% of population have this muscle, and the rest do not have the muscle. And that's all.